Our body literally is light. It's not a metaphor, right? There's a lot of metaphors out there talking about we are light beings, but we literally emit light. We create light, we emit light, and we respond, and our body works and gets the signals from light.
Welcome back to the Quantum Lens podcast, and I am so excited to have Rachael Maurice on the podcast today. Rachael, thanks so much for being here.
Thank you so much for having me.
So we connected in the quantum biology space, and I know that you were a former anesthesiologist. Is that correct?
It is, yes.
And my daughter, we were considering having surgery because she had she had a couple of bones in the last few months. So it turns out she needed surgery. And I was picking your brain. I was like, as a former anesthesiologist, what are the questions I should ask and all these things? And so thank you, first of all, for just being so open to connect and helping to answer questions and really put my mind at ease around that situation.
It's my pleasure. I really feel any information, any kind of value that we all have individually, if it can help other people, it's our duty. So you're more than welcome.
Well, thanks so much. Yeah. And audience, if you guys are in a situation where you need to have medical intervention and surgery, I do have a free resource that I've put together. It's on my website under free resources, and it's all the questions that you should ask your anesthesiologist and a surgeon. So that's out there for you.
Oh, sweet.
Yeah. Sweet. Well, tell us about your story, because you were in the conventional medicine space and now you do something totally different, but I'd love to hear your background.
Okay. Thank you. Yeah, it's been a complete turnaround. Never thought I would be where I am today, but so grateful that I am. So yeah, I grew up in a very traditional household with my father, who was actually a medical doctor as well, and my mother, who went through several careers and a lawyer, real estate agent, nurse. And so I just kind of followed the path of academics and just thought I'd be going to school and I had an aptitude for science. It just was very intriguing for me, but I wanted to work with people. So going through school, I ended up going into medicine because I preferred the clinical aspect, but I didn't want to do bench work science. I did that in my undergraduate degree and found that I did not like that at all. So I wanted to do more clinical application of science, and that just blended with medicine so well. And so as I went through my medical school training, I had a lot of I would say, epiphanies based on the interactions I had and behavior that I saw of the people around me. And I stayed away from, for example, surgery. And it's interesting, I'm an anesthesiologist that went into the operating room, but stayed away from surgery because we had several surgeons or even specialists come talk to us at lunch hours in our last year of medical school to give us an idea of what our lives would be like based on their experiences. And what I found from surgeons, in particular female surgeons, was that they felt that they had to really prove themselves and had more of a masculine edge, and they didn't have the same care and kindness that I felt that I wanted to share with patients. Just as an example, that these three women surgeons and one lunch hour were trying to one up each other on how quickly they went back to work after having a baby. And the plastic surgeon went back after 1 week, and my jaw was on the ground.
Wow.
and yeah, kind of criticized another one for taking 3 months off. And that one said she had been hospitalized and that's why she took 3 months. And I said, yeah, that's not for me, because I wanted to participate in raising my children. In any case, I chose anesthesia. There's a lot behind why I chose it. So I went straight through my residency and started work right away. So I've been in the medical field now for about 30 years, and just about 20 years of those as working as an anesthesiologist. I did work part-time for what part-time medicine means, so that I could be home raising my kids. I have 2 kids. And they are, the loves of my life. They are the reason. Yeah, they are my priorities. It was about in 2021 that I actually left medicine. And I didn't think that I would be leaving for very long, but maybe I'll step back a little bit. 2017, my mom was diagnosed with cancer. And I really did not look outside of traditional medicine for anything prior to that. I used pharmaceuticals. I've only shared this actually on one podcast before, but I went through a terrible, long, drawn out divorce, and my kids were very young at the time. And there was a point where I needed some support with coping, and my doctor didn't suggest anymore. She basically insisted that I go on medications to help with a lot of anxiety and stress. And that was probably one of the worst experiences now in hindsight that has happened to me, in the sense that those medications are not what people think they are. They're not told. Most people understand, they go to the pharmacist and they'll give them like 5 pages of a list of information to do with whatever prescription they're given. I don't know anybody that reads it, including doctors. So it was very difficult to wean off of. It took me a year, and it was really difficult to get off those medications. And I know I'm kind of jumping a little bit all over the place, but as an anesthesiologist, before patients come into the operating room, we go through their entire charts. And one of the things is their list of medications. And I can tell you that a good 90% of people that I would see, whether they were sick or not, were on some type of psychiatric medication for anxiety, depression, mood disorder, something to help with stress. And so it's not an insignificant thing to talk about. And that's one of the reasons I'm actually bringing it up. But yeah, so I was very much in line with all of the traditional treatments and surgery. I would say now that I am no longer in that position, I feel like I really was indoctrinated and brainwashed to not see anything outside of what I was taught in that system. 2017, my mom was diagnosed with cancer, and she was okay with surgery, or just surgery. She was not interested in having any kind of chemotherapy and radiation. And I'm sure it had to do with the stories that I had told her over the years. But that led me to researching about nutrition, which sounds kind of odd to say, from coming from a physician, to go researching nutrition, because it really is the bedrock of well, not the bedrock. Everybody eats every day. I was going to say not the bedrock, because we know a little bit better now with light and the sun and the earth and so on, which we'll get into. But everybody eats every day, and nutrition is part of what makes up our cells in our body. And so it seems a little odd to say then I would go research nutrition, but we're not taught anything about nutrition in medical school. At least I say that in Canada. I know other places have told me, but I can say without a doubt in Canada, because I've been through the system, and started realizing there's so much more that can be helpful for people who are sick with changing their diet. And so we started down that path, made some changes. And then a period of my divorce, which was another kind of upheaval, led me to discovering Dr. Joe Dispenza. And that completely transformed my life and my understanding of really how the body works, how we are connected, how energy plays such a vital role in the expression of our physical body, which, as an aside, we use it in medicine, yet we are encouraged to criticize it. For example, an ECG, which monitors the electrical current coming from a heart, or the EEG, the electrical current coming from the brain, and we have one for the muscles as well, the EMG, that measures energy. It's a magnetic field when you have an electrical current. So it's used in medicine. Yet when there's any kind of therapeutic strategy, it's completely mocked and dismissed. And so it just goes to show the severe compartmentalization that most healthcare practitioners have in the allopathic system. Joe Dispenza helped me immensely, and that started me down the road of really becoming passionate again about learning about true health, because what I'd been doing before was really managing disease and at best delaying the progression. And what most people understand, I think, putting a Band-Aid on and disconnecting the signal, the symptom, the conversation that your body is telling us. It's just, with traditional medicine, we just tell it to be quiet, right? Just like children, to be seen and not heard. And along those lines, I was really looking for a way to leave my career, but I had known, that's all I had known. And I'd been practicing for so many years and I knew it like the back of my hand. We're paid very well, right? I worked part-time and I was able to support myself and my children and be comfortable. So it's hard to step out into the unknown and trust and have faith. And so I was really struggling with that, but I wanted to. And then 2020 came around, and that was the universe and God telling me, this is your time. This is your time to make a decision. What do you really want to do? And so 2021 came around with basically the rules of either taking the shot or not being able to work here in British Columbia in Canada. I don't know if I said that before. I'm Canadian. And I was not willing to participate in the experiment because a lot of things were not making sense to me based on what I had learned and just my intuition. I walked away again, like I said earlier, not thinking it was going to be for very long, but having the time away from that space, that environment, knowing now even a little bit deeper, but it's not a place for any kind of health or nurturing of the soul or health, just that hospital space. And the way the structure is set up, it is not supportive of one another. It's not really supportive of patients. I mean, we can go into a lot of details about that after if you want to, but I didn't realize that until I took the time away and started to feel healthier.
Mm.
And then I started questioning whether I would go back if I was even allowed to or asked back. Now, here in BC, again, I think it's different for some reason. Everything seems different in British Columbia, including the science, because it took 3 years for them to lift the mandates here for acute care workers. But it became evident to me that I was not going back. And along the lines of things that didn't make sense and things that I wasn't taught, I discovered quantum biology. And again, another pivotal time for me because it really crumbled the whole foundation of my understanding of how the body worked, even beyond the energy, because it expanded it into that our body literally is light. It's not a metaphor, right? There's a lot of metaphors out there talking about we are light beings, but we literally emit light. We create light, we emit light, and we respond, and our body works and gets the signals from light even outside of us. So all of the biochemistry and the pharmacology and the physical nature of the body that we practice in modern medicine is so limited because what's missing is the upstream signal, which is from light and how our body responds to light through the water network in our body as well. And that was just mind-blowing to me. I mean, initially it was a bit disturbing because I thought, holy cow, at the time I was 50. I'm like, what did I do for the last 50 years? What am I gonna do going forward? But after that, I started to get, again, really excited because it's so much simpler than we've been led to believe to be healthy. Our body was designed to heal. It was designed to heal given the right signals. And if we lived in this beautiful world that we're trying to create, which we were talking about earlier, and which again was created for us, every single person would be thriving. But we've interfered with that in the modern world on so many levels. And so it's really about getting out of our own way, allowing the body to do what it's already designed to do. I mean, just the mere idea. I was explaining something to my daughter the other day, and she kind of tunes out when I go into any kind of scientific detail whatsoever. So I try to create analogies where she totally understands what she does, but you don't have to have any scientific background to be able to understand this. And one of the things I said is, I mean, lots of people take science in high school and know what a chemical reaction is, but we've got 100,000 reactions going on in every cell every second of the day. There's an intelligence beyond anything man can ever figure out for that to be happening in such exquisite timing for everything to work properly. Like our body knows what to do without us knowing or interfering. And so it just, again, so much simpler. I started implementing things that were just really more about taking away all, for example, all the supplements, taking away all of the extra things that I was doing in my life, getting back to nature, getting the natural light. I mean, there's nuance. There is real nuance to doing this in our modern world because there is so much that we are, again, interfering with. So it's not as simple as just getting outside. I mean, that is, we do want to get outside, but there is nuance to how we can help ourselves and support our body into that, get back into that healing state and allow it to do what it's designed to do.
Okay, can we take a step back
So,
real quick before we move forward into
yes,
that direction? Okay.
absolutely.
One thing that really struck me that you said when you were talking about the sheer amount of people that you saw on depression and anti-anxiety medications, and that really hit home for me because I remember after I had my babies, I can't tell you how many times, Rachel, like my intuition has told me something and I've gone against it because of medicine and doctors were telling me something else. And I wish I was strong enough, but I guess this is just my own health journey. But after I had my children, I was like, I had them really close back to back. And I was like, my body really needs a break. I had two C-sections. Of course, the doctors are going to advise an IUD. And I remember this IUD energetically, my body felt off from the moment that they put that thing in. And I went back. It has to be like less than 3 months later. And I was like, you're taking this out. I've gained weight. I had this, and this symptom. And she just looked at me and she said, that's not a symptom of an IUD. And I was like, no, like nothing else in my life has changed. This is definitely a symptom. But I feel what kind of happens is sometimes you get bullied into not trusting your own intuition and your own body because they're taught from their sales rep or whatever that was not going to be a symptom of this medication. And I remember she basically refused to take the IUD out. And I said, I'm not leaving here until you take it out. And she said, you need to go home and think about it. And I said, I'm not leaving here. And then she tried to put me on depression medication because I
Wow.
was listening to my body, I was listening to my intuition. I was definitely having symptoms, but not only were those symptoms I was being told I wasn't having and how to feel, she literally tried to put me on depression medication.
Wow. I'm sorry.
Yeah, it's just I wonder how many people go in for something like super routine or just an annual check or something, and then it's almost like we're numbing, kind of using
Uh,
pharmaceuticals to numb our intuition in a way, I guess is what's coming forth for me.
Absolutely. I would absolutely agree with that.
Yeah.
It's and it's so unfortunate. I know many who are in healthcare who really care and their intention is good, but the toolbox that they've learned, right, is so limited. And then they're also, and I say this because I, you know, grew up in that space, we are taught to believe that we are the upper echelon of society. It's really it's enculturated. So therefore there's an embarrassment with a lot of people if they don't know, if they don't have an answer to something. So it's not easy for many to say they don't really know. And so then they will choose something. For example, that's in a sense what it sounds like to me. They're trying to fix something when they don't really know what the issue is.
What's interesting is I do find that you'll find the people that are curious. About a year and a half ago, my mom was in the hospital. She had pretty major surgery, one of which was removing some brain tumors and some reconstruction things going on with her face. She had had osteosarcoma in her jaw. And I spent 20 days by her bedside and I brought red light panels and grounding mats and, played different Hertz music. And I had um, my tuning forks. And I mean, I brought an entire suitcase of tools that Yeah, we're in a hospital, but we're going to make the best of it. We're going to bring all the tools to help bring nature inside in a situation where it's impossible, right? You're hooked up to all the machines, you can't get outside, put your feet in the ground and all this stuff. And that experience was really interesting because you would have some doctors and nurses so curious. They're like, what's that? Ooh, like I want to learn more. And then you had the other ones that literally it looked like a production. Okay. I mean, it was ridiculous. And people who completely ignored it because they just were closed off and they didn't want to know anything about it. Or, like you said, maybe it's a kind of like, if they don't know anything about it, it's kind of like a hit to their ego. They won't ask even. They're not even curious.
Yeah. Well, that's good that you did that.
Yeah.
Yeah.
So, well, I resonate with you like on a soul level because I think when your mom gets sick, it's one of these, the nurturer part of us just wants to step in and help. It doesn't matter who's right or wrong at that point. You just want to bring
Right.
in your whole toolbox to help them get well.
Yes. Yes, absolutely.
And so I think I heard a story of, I think maybe you were saying something about a LifeWave patch and your mom. And I thought I heard a story. I was wondering if you would be willing to share that with us.
Yes, absolutely. So along the learning this path of quantum biology, learning about light and types of phototherapy, I had heard about these phototherapy patches probably about, so it would have been about 2 years ago. I didn't investigate further because I just thought from the person who had shared it that it was another type of red light device, but wearable. I didn't quite understand it. But it was then through someone else who came back, and I knew this person very well. And she had been through a horrible situation. I had worked with her for almost a year monthly, and she took a bit of a break. And then we started working together again after a series of really awful events that had taken place. We got on a Zoom and she was radiant and she was glowing. And I said, no disrespect. I thought that you were just going to look like a train wreck. And I said, but you look amazing. I said, what are you doing? And she said, well, I've started on these patches. And so that's when I said, okay, I've got to actually look into these. And the timing was such that that was when my mom's health was starting to decline again. So not cancer, but her heart. She's got multiple medical issues and she's got heart failure. And she often doesn't necessarily like to share what's going on because I do try to help her and give her advice, but then, family doesn't always follow. And then she thinks that I'm going to get mad if she's not following my advice. So she doesn't disclose some things sometimes, but we walk together on a regular basis. And I know that her heart wasn't doing well and she's got sleep apnea, but she told me that her doctors were looking at heart surgery. And so again, having worked in the operating room for 30 years, I know that we can get anyone through an anesthetic or just about anyone through an anesthetic, but it's how they will fare afterwards and recover. And my mom, I knew, would not do well. And so the timing of it, again, was such that I started investigating these phototherapy patches, LifeWave. The person who then was someone I signed up with, who I was connected to, was a cardiac surgical nurse for 20 years. So this was a divine connection, right? I knew that she came from the same understanding and teaching that I had and experience. She had been with the company for a year and a half. She was sharing not just stories, but investigations, meaning tangible, objective evidence like echocardiograms and electrocardiograms of people she said had gone from severe heart failure, where the heart pumps maybe 15 to 20% of the blood, that is severe heart failure, to increasing that to 40, 50, 60%, which in the time frame was 8, 10, 12 months. I have never seen before. And while I only did my cardiac anesthesia specifically in my residency, I saw cardiac patients almost every day. Almost every patient that I would see had some cardiac issue. So I'm not unfamiliar with this. It's something that I said to my mom, you're going to try this. I'm not going to ask you, you're going to try this because we're going to make sure that you avoid surgery. And healing takes time. So I prepared her not to expect an instant result, which we, again, in society are conditioned to with pills, with surgeries, with everything, instant results. And if they don't happen, the thing doesn't work. So that's not the way the body works. And I got her prepared for that. We started on them. I got her started on them. I started on them as well because obviously I'm very excited and I'm just everything to do with light. And we walk on a regular basis. And within 2 weeks, I did not expect, I was shocked. I was absolutely shocked because she went from having to stop and catch her breath every 2 to 3 steps to literally walking blocks, talking to me at the same time, which requires extra energy, and on a slight incline, which normally before she would just totally avoid because she's like, we can't go that way because there's a hill. And two weeks, I still couldn't wrap my head around how that worked. I did ask David Schmidt because luckily enough, Dr. Sarah Pugh had me on her podcast when she interviewed him. So I got to ask him how that worked. And it just goes to show that I was still stuck in that former model of thinking of the how physically it could possibly take place. Meanwhile, it's an energetic thing that changes the physical nature. So the way he explained it, I understood afterwards. But then within 3 weeks, she had to have her thyroid medication lowered, which again, that was the least of her problems. That I saw. So I was not expecting that at all. And then things, I was going to say smaller things. Nothing is a small thing, I would say, when there's a change in the body, but she had a lot of skin issues because this skin is a representation of what's going on inside as well, right? So 80% of her skin issues went away in the coming months. Her spider veins started diminishing, right? And that's part of the vascular system. Her varicose veins started getting smaller. And she just had an energy and a glow about her that was very noticeable to people that she would see that was not that kind of outside of family who hadn't seen her in a while, right? So there was a noticeable difference. I mean, that was a huge buy-in for me too, right? When you see something right in front of your eyes change that rapidly, and with these patches, and for those that are listening, we haven't kind of gone into the details about them, but there is nothing going into the body from the patches. They are non-transdermal. So what they do is reflect the light that we emit. So with phototherapy, usually it's an outside source of light, but these patches use our inside source of light to create the signals to change the physiology. So yeah, it was very remarkable.
Wow, that is incredible. And some of the stories that I've heard about someone being like paralyzed and then being able to walk, I mean, it is incredible. And I think too, you'll probably agree with this when you put your belief system in the energetics of it, that this is going to work for me. Like your body will do miraculous things to kind of fulfill that vision for you, right?
Absolutely. And I know some people listening who have not heard about LifeWave before might think, oh, okay, here we go. Like another one of those things that it sounds too good to be true. It really does. And it did to me as well. But it was also on the heels of me kind of really rearranging my entire thought process around how the body worked and how health worked. So it was a little easier for me to put my beliefs into it. But I've seen nothing like this in the 30 years that I've been in medicine. And when I started going down the nutrition route, when my mom was diagnosed with cancer, and then Joe Dispenza, I started looking into everything. And not to say that there is not validity and use with all the other things when we're talking about sound, because sound is frequency, right? And anything to do with frequencies, there's other types of um, I would say frequency tools out there. I've tried a lot of things and nothing has really impacted me significantly enough that I've noticed. Or some of these things require a lot of time and effort, and therefore it's difficult for people to put into. Even just standing in front of, say, a red light panel, it takes time. Or if you don't have one, you've got to go somewhere to use it or to get if you don't have a sauna, like if you don't have the money, a lot of people don't have the money to go buy a sauna, to buy a red light panel, to, so you've got to go somewhere to do it, or go to have acupuncture, or go somewhere. So it takes time out of your day. It's effort. It's, there is money.
Expensive.
That's the funny thing. Money, people's idea about money and where they're putting it as an investment over in it as a, instead of it being an expense, right? A lot of people really see things as an expense. And when it comes to our health, I would say that it's an investment, because you're going to pay at some point for your health. You're either going to pay to help prevent the decline, or you will pay once you get to that decline to try to get yourself better. Like it's, you pay at the front end or you pay at the back end. So
Well, and Rachel, I don't think I've even shared this testimonial with you, but I'm going to share it with the audience now. My daughter had elbow surgery, and we don't take medications in our house, and they prescribed her a narcotic. And I kind of looked at the surgeon and I said, she's never even had Tylenol. Like, how are we going to give her a narcotic? And I got a speech. This was literally like 2 months ago. I got a speech of how dare you put your daughter in pain, and she's having a screw put into her elbow and blah, blah, blah. And I was made, I'm going to say it, like I was a piece of shit. Like I was a shitty parent who was not going to give my daughter pain medication. And I kind of questioned myself for a second. I said, well, I mean, if she's never had Tylenol and I give her Advil or something, right? Like, wouldn't that work even more on her because she's never had it? Would it be like a little bit more effective? And I was told, no, you need to give her the narcotic. So I asked him, I'm like, hey, just make sure, can you do a nerve block? So when she's coming out of it, all the things. Anyways, my daughter has never taken the pain medicine. She never even wanted Advil or anything for pain, but she was uncomfortable. There was some discomfort. And I said, oh, have these things called the LifeWave patches. I mean, I bought them because they're for pain, but I've never used them. My body's not in pain. Never had an instance of when to try it. And I know there's a certain way to use the patches, but I'm very intuitive of how I approach medicine and with energetics and everything. And so there's two patches, there's a brown one and a white one. And we just put one patch on one side and one patch on the other. She had instantaneous relief, instantaneous relief. And I couldn't believe it. And so my husband and I were wearing the patches every day. I hadn't necessarily noticed a huge difference in myself up until this point. And when we put on that patch, that LifeWave patch onto her elbow, I was a believer from that point forward. And then she would even ask for it. Mommy, could I have the patches again? And I was like, this is amazing. This is literally nothing is going into your skin. You're not injecting anything in your body. You're literally using your own light to heal yourself. How beautiful is that, right? We talk about different ways to help yourself heal, doing your own blood donation before surgery. That way, if you needed more blood, you have like your own blood, right? There's lots of different tools. Like if you ever needed antibiotics, you could do your own fecal transplant. Like there's different things that you can do where your own body helps support itself after different things that you're going through. But this was something that just felt so natural to me. It's like literally you're using your own body as using its own light to heal itself.
it's really brilliant. It's brilliant. And that's amazing. That's amazing. And that also is a testament to, because sometimes when I share this, people will say, oh, it's probably just a placebo. And I mean, first of all, what I say to that is, okay, if it is just a placebo, then amazing. I mean, if
Right.
we can do that as a placebo, then that a lot of medications, that's how they test whether a medication is useful. And we won't go into that because of the corruption in research. But when it comes to children and animals, there is no such thing as a placebo, because the kids don't get it. And, especially little kids and animals, absolutely. And these are used as well on horses. There's one in the US, they market it towards horses. You can use, it's the same one as the LifeWave that you were mentioning, the pain one. But then also, I wanted to mention for your listeners that because what I've found is some people have reached out to me and said, oh, oh, it's the same. I've heard of these other patches and they do the same thing. And I just want to share that these LifeWave patches are unique and they are not like any of the other patches out there on the market. There's a patent on them, and the X39 is what it does is it increases a specific copper peptide that we have that increases our own stem cell activity. So an end number. So it is using our own stem cells to help us heal. There is nothing else on the market that does that. There is nothing else out there that does that. So I just wanted to kind of clarify that and make sure people understood. This is a unique and very proprietary technology.
Yeah. What's interesting is when I hear stem cells, the first thing that comes to mind that I know about stem cells is one, we're born with a lot of them. Even the umbilical cord has stem cells, right? If you're like me, where you saved your baby's cord blood or the actual it's being stored
Yes.
somewhere. Hopefully it's still there. Or the other thing is you lose stem cells as you get older. And then now there's all these therapies where you're actually injecting other people's stem cells, like in other countries, which to me just sounds a little. I'm not sure I'd want to be injecting somebody else's something into my own body because energetically we know how that interaction can go. So maybe educate us a little bit on stem cells.
Yeah, no, and that's a great question. And I did that very thing when my kids were born. I mean, that was 18 and 20 years ago. But I got the stem cells out of cord blood and banked them somewhere because we're actually not taught a lot about stem cells in the traditional medical education. What we're told is the same as what the public understands, that we lose stem cells as we age. And actually, once we've kind of stopped growing, that we no longer actually have stem cells. That literally, that's what I thought. And I was in medicine,
Oh, wow.
right? But what we don't realize is, although we stop growing sort of, beyond the teenage years, we don't see the growth, right? We don't physically grow in the way that we do through puberty or through childhood, but we grow in the sense that we're always turning over cells, right? So we've got, for example, our GI tract. In an ideal world, optimally, we should be turning over all of those cells within 3 to 4 days,
Mhm.
right? That doesn't necessarily happen, but optimally, that's what should happen. So our cells get used, they're damaged, they're worn, they die, and they need replacing. So what replaces those cells? Stem cells replace those cells. So stem cells are, I've heard someone, I guess, call it, they're like the baby cells. They're the cells that have all of the instructions to become any cell in the body. Actually, every single cell has all of the instructions, but once they're given an instruction to become a certain, to differentiate into something, for example, like a skin cell, then they become a skin cell. They still retain the instructions, but as that skin cell, they don't necessarily go back to become a stem cell. They can, as I'm saying that, I'm like, okay, they can. I don't want to get into the confused people, but so the stem cells are the cells that go and replace the damaged, dying, and dead cells in our body, all over our body. So as we age, by the time we're 30, half of our stem cells have gone dormant, meaning they're just not active the way they used to be. We're not giving off the same instructions, signals, chemical reactions, chemical mediators in our body to direct them where they need to go. By the time we're 60, 90% have gone dormant. So it sort of follows most of us understanding that as we age, we just feel like we are starting to fall apart. And I witness that all the time in the hospital, right? People healing. It doesn't have to be in the hospital. I'm just saying I spent a good part of my life there, but most people know when you get an ache or pain, or when you get an injury, or if you get sick, you just, as time goes on, you don't recover as well. And I love, someone had said this to me, when people say, well, actually, I feel pretty good. I feel pretty healthy. I mean, I know that we hear that kind of thing all the time. We know that you can live with up to 70% dysfunctional mitochondria and say, I feel healthy, not know what's going on underneath. But this idea of feeling healthy. People don't know what's going on underneath, but if you say to them, okay, think back to when you were 30 years old, if we're talking to someone who's obviously a, a little bit older than 30, but think back to when you're 30 years old, how do you feel now compared to how you felt when you were 30? Then people have a little more ability to remember or see the difference, as opposed to we just get used to living a certain way and we get used to a certain ache or pain or immobility in our life, or for example wearing glasses, we just get used to it and then we don't think of it as a problem, but it is a decline in the function of our cells. So yeah, so stem cells, again, that's sort of a hot topic for stem cell therapies. People travel around the world. People who have money, it's in the tens, if not, people will spend hundreds of thousands of dollars. It's invasive, like you said. You can harvest your own. I've heard it's extremely painful, or you can use someone else's, right? But again, using someone else's, one of the complications, there's risk, right? There's risk involved, there's potential for complications, but one of the complications is when you inject stem cells from outside into a specific spot. Like let's say, so one of the research studies that they did was they injected into, unfortunately, into monkey brains, right? To want to create more brain cells. But what happened was you can't direct that stem cell into what it's going to be. So it turned into hair cells, muscle cells, bone cells. So you don't want that in the brain, right? That's one of the difficulties with injecting stem cells from outside. Now, with this technology, it's using our body's own wisdom. So we're not interfering in any way with what the body's already doing. So the body already knows what needs priority, what needs healing, where to go. It's just, I mean, it's beautiful. It's absolutely beautiful. And you don't have the risk, right, of it being invasive, someone else's not directing it. As well with the injection stem cell therapies, they are only able to be used locally. So if you inject it into a joint, because a lot of people do that for joints or for other issues, it only technically works where you inject it. Whereas again, these patches, the peptide that's increased, it is found everywhere in the body, so it will go to work wherever the body needs it.
That's what's so beautiful about this is I think sometimes, and we'll kind of wrap this up, Rachel, too, but sometimes we think we know better than our body. We're like, just because my knee is hurting, I'm going to go inject stem cells in the knee. But however, our body knows if your liver needs support, if your gut needs support, right? Like there are so many processes that happen in your body, and your body intelligently will prioritize the most important things first. And
Right.
sometimes we get in our own way because we think, well, this is where I'm having the pain, therefore, this is where I need to inject this. But if you just give your body the raw materials, the raw tools, it will actually do the work for you. And there's no guessing involved, right? You could be injecting all these
Right.
things, and yet your body's still not getting the health signals that it needs because maybe it's needed elsewhere.
Right. And if you don't mind, just I know
Yeah.
we're going to wrap this up, but for people who still have difficulty understanding that you could feel something in one part of the body, but the signal or the problem is actually in another part of the body. This analogy that was given to me, it was a visual and it was so good because this was a person who does fascia work, and how he showed it, and I can't really show it here, but describe it is he crumpled up, like he put in a ball, like a part of his t-shirt on the bottom. Like, so he like scrunched it up into a ball here, right? And what he said was, he was talking about fascia, how it's interconnected all over the body. While it's all crumpled up here, you're going to feel it. Like if you try to move your body here, you're going to feel it in your shoulder. You're going to feel it in other parts because it's tight there because of the problem here. Just because you feel something, for example, in your shoulder, it does not mean that the problem is actually in your shoulder, which was so interesting and so different and the opposite of how the modern medical, paradigm works.
Well, it's so
And
interesting that you say that because so I have a massage therapist that comes to my house once a week, and I was having a weird pain inside of my knee. So it wasn't on the outside. So I knew it wasn't like I didn't hurt myself. It was just on the inside of my thigh and knee right there. And so I was asking her, what could this be from? And she showed me how from the inside of the knee, it actually comes all the way around to the hip and actually down to the foot. And she showed me exactly where all the tightness was in my body. And then she said, this is how you fix it. You actually have to watch where your foot is landing as you're walking up the hill, because she knows I walk like 6 to 10 miles a day. And I made that one change, and all of a sudden, no more knee pain. It was
wow.
it was insane. And so again, sometimes if we're not the professional or we don't know, that pain could be stemming. I would have never thought that it was the way that I'm walking up a hill that is causing
Right.
that knee pain, that's causing the tightness and the pulling to cause that pain. So that's a really awesome example.
Yeah. Oh, wow. That's neat. That's great. That's great. And that's great that you could correct it, right?
Yes, yes.
Well, as opposed to medication or a needle or
Steroid shots and all the things I've done in the past that now I'm like, I know better. um, I feel like we could keep talking about this and go into so many more details. Maybe if you're up for it, we'll do a follow-up session where we can dive more detailed into some of the clinical things that you're seeing and outcomes and kind of the different
yeah.
patches. That would be a really fun conversation.
Okay, that sounds great. That'd be
Awesome.
wonderful.
Well, I end every single podcast with a single question. And so I was wondering, what does love mean to you?
What does love mean to me? Um, so that is I love this question and this idea, and that you end the podcast with this, because I think that we need more of it in this world, especially today, because so many of us have disconnected our brains from our hearts. And love really, to me, starts within each of us and loving ourselves. And I wouldn't have understood or said this not even that many years ago, realizing the interconnected nature of everything and everyone. Society's done a really good job of programming us to not love ourselves, to see fault and damage in how we show up in the world, how we have relationships, how we, that we're broken. And what I would say is really, I wouldn't say that it's not easy. There's a lot of peeling of the layers of the onion that we have to do, but we are pure love and light within us. And I think we just have to start to see that and really believe that. And when we love ourselves, there is nothing that stops us from loving everyone else around us. It's a ripple effect, and it helps shift those around us that are having difficulty be able to tap into that as well.
Beautifully said. I love that. And you hear people use the term love and light, and I've heard that in the spiritual community so many times. But now knowing what we know is it has a completely different meaning to me. And really being able to shine that light on other people's path and influence it through the love that we have for ourselves and that we share with others has a huge effect on the collective now that we know that we are intertangled. And so that's a really beautiful way to look at it. Thank you for sharing that.
Thank you. Thank you for having me.
Yes. Thanks so much for being on the podcast. And yeah, let's schedule a follow on. Let's have another conversation. I feel like that would be a really great chat. So thanks again.
Okay. I would like, all right. Thank you.
Okay. Thank you for tuning in to the Quantum Lens podcast. I hope this episode brought you insight, inspiration, and a deeper connection to your journey. If you've loved what you heard, be sure to subscribe, leave a review, and share it with someone who needs to hear this message. Let's keep this conversation going. And until next time, keep aligning, expanding, and embrace the magic of who you are.